WCEG network on the WCEG Talk Radio. We are the worldwide community empowerment group where we speak life into the community. I'm Dr. Babs, your show host for this evening's segment on the holistic perspective. We are here to enrich you with information that will be impactful and inspirational and get you living at your best health ever. So in honor of this month, which we call our World Health Month, I will be discussing advocating optimal health for all, right? For all colors, all age, all gender. That is what we're going to be talking about today. So the question for the hour is, what does it mean for you to have a supportive environment for you to be able to thrive, right? Thrive at your optimal health. So that is the conversation today. That is the question I want you to be thinking as you're listening in. My goal this evening is to discuss what it means to celebrate World Health Day and how do we advocate for ourselves, right? Ourselves, our community, and then I'll end with commonly asked questions. But before we get to that, please tag your friends, right? Tag your neighbors. I want you to stay updated with all our amazing programs on the WCEG network show. We are live on all social media online platforms, just name it, YouTube, Instagram. We are also live on the Talk Radio, WCG Talk Radio Network. We do have some new platforms, so free mobile app, make sure that you download both for iPhones as well as Androids. You just search WCG Network TV and you will get on it. So we are here to make meaningful impacts and we appreciate your support and your time. So please, please, please help spread the word. I do have two important announcements before we get started. First one is that the information shared on this talk radio is not intended as medical advice. It's just to provide educational information to support you on your journey, right? Your journey to holistic wellness. And then the second announcement is that the views and opinions expressed by myself or my guests does not necessarily reflect views and opinions of the WCG network and its management. So I always like to start with a quote, all right? And the one that I'm going to be discussing right now is anonymous. I really don't know who said it, but I think a lot of people say it quite a bit. So it says, I believe that the greatest gift you can give your family and the world is a healthy you. So let me say that again. I believe that the greatest gift you can give your family or the world is a healthy you. So we fill our cups, we're good for ourselves, we're good for our environment, we're good for our community, right? If we're not healthy, we're not good for ourselves and we're not good for the people that we love. So we are going to get started. So I want to start by asking a very important question. What does World Health Day mean? Well, a little bit of information about World Health. So this is a celebration of a public health advances, right? In an effort to promote health for all. And this day is celebrated on April 7th. So we're like 2 weeks away, but I believe that this should be every day. So in April, it's celebrated, but it should be every day. And this was created by the World Health Organization in 1948. So that means this year, we marked the 75th anniversary. And there's been a lot of public health milestones that have occurred over 7 decades, right? Some of them, I can list a few: eradication of smallpox, polio. We've also had a lot of life-saving childhood vaccinations, even though there's still some little controversy about a few of them, but we know from the data and the science that we do prevent a lot of diseases. We've had some advances with motor vehicle safety. We've had large reduction in motor vehicle related deaths because of, seatbelts and the way the cars have been modified. So there's a lot of improvement that we've seen in our health. We also have, of course, with the recent pandemic, we've had recommendations to mitigate horrific impacts from a COVID patient. So whether you had COVID and how to heal and to prevent the spread, we've had all these public health advances. But as you can imagine, we still have tons of challenges that are way ahead of us. And this involves health disparity, where it threatens lives and well-beings of people, especially in the marginalized, in marginalized communities. So racial, ethnic, whether it's socioeconomic status, rural communities, people with physical and cognitive disabilities. So there's still a lot of challenges. So there's still a lot of work to be done. Now, why does this matter? Why does World Health Day matter? Why does it matter? Why are we saying all of this? Well, several reasons. One, we know that 60% of the United States adult population and 25% of our children have at least one chronic disease. So when I say chronic disease, I mean lifestyle related chronic diseases. So whether it's hypertension, diabetes, high cholesterol, heart disease, dementia, one person, 60% will have one of those. 40% of our adult population will have two or more. So that is quite a bit. And it is affecting our just overall health, our overall productivity. In chronic diseases, as I mentioned, diabetes, unfortunately, is disproportionately affecting vulnerable populations, right? So Black and Latino communities. I see patients at Grady, and majority of my patients, if I see like 20 patients a day, I promise you that 18 of them already have some chronic disease, Black and brown. So this is what we're seeing. And we know that this is due to so many reasons: decreased access to healthcare, healthy foods, and sometimes educational and economic opportunities. So we need to break this barrier and make sure that we close the gaps of all these challenges that are here, and of course lifestyle related diseases, because we know now that lifestyle medicine can prevent, it can treat, not manage, and it can also reverse these chronic diseases. Another reason why it matters: this month of April is known as Black Maternal Health Week. This whole month, there's a week aside to that. Excuse me. But it's so important because we've heard, we might know people that this has affected, and it's something that we need to do something about. I know that I have my own personal story, but I had to fight. I had to say, no, I know my body better than anyone. I know that my baby is ready to come out. Call the doctor. Excuse me. So we do need to make sure that we're aware of this. Health for everyone, not just white communities to be able to go home with their babies, but the Black communities to be able to go home with their babies. Number three, another reason, excuse me, the allergies is getting the best of me, but let's keep it going. So another reason, 3, is, I'm not sure if you're aware that in 2003, we had about 58 of African Americans had just basic health literacy compared to 28% of non-Hispanic white. So this month is also what we call the National Minority Health Month, where we need to increase literacy, so health literacy. So all of this matters. If we have all these things combined, we're going to have health for all. So the Department of Health and Health Services offices, they encourage us to work in our communities to improve our health literacy. So today I'm going to share a few things here that I want you to just tap into, right? And see how that would influence your health, influence your family, and spread out to the communities, right? So my goal here is to discuss how we as community members can enhance our commitment, right? To 1, being self-advocate. So for myself, for my communities, 2, work alongside healthcare professionals, right? As well as healthcare and community-based organizations. So that means we're just going to build engagement. So let's talk about this. I want to start off by saying that this does take work. It's not going to be a walk on the park, but anything good, anything that is worth doing is worth doing well. So we are all responsible for this. If we want health for all, we have to do the work that it requires. And we also have to first examine ourselves. Right? So this is going to be like a reflection time, ask ourselves, what am I doing to help my community? And that's why I love the WCEG network show, because it's all about community building in different areas of life, holistic approach, finances, medical, it's spiritual, it's occupational. It's just a great organization. And I want to use this moment to just applaud Reverend Rogers for just taking up this task of building the community. So thank you so very much for doing this and just growing your community. So back to what I was saying, we are all responsible. It is not just one person alone. We all have to, first of all, look within. what are we doing, right? The reason is because systems, cultures, they're made by people, right? We're the ones that come up with all these cultures, we come up with all these things. And it starts with education. That's how we can shift the needle. That's how we can change the narrative and do things that are more health promoting, right? So cut back on the diseases, cut back on the maternal child health, death, to cut back on the health illiteracy. So it starts with us. So I have this acronym called GPS. I actually heard it somewhere. I did not create it, but I love it. GPS stands for G, gather information. Okay, so the number one we're going to talk about is you being a self-advocate. So gather information is the G. When you're gathering information, it means ask questions, ask questions, ask questions. Don't ever think that somebody knows your health better than you. Now, of course, we can listen to our doctors, we can listen to other people, but you know yourself best. You live in your body, you know your situation, you know your homes, you know your unique situation. So always gather information. Be like a sponge, gather all the information, ask the questions, right? So ask the questions from your healthcare provider, make sure that you understand your condition, the treatment. When I'm in clinic and I tell my patients, what their thought process, what they're feeling, what they need, and say, you're the doctor. No, I'm the doctor, yes, but I'm only serving as a guide. I don't live in your house. I don't know your unique situation. So if you rely on just your doctor to give you all the answers and all the solutions, then you're not getting the best. You're not maximizing the potential. Now let me share two pictures that actually will help share, give you an idea of what I'm talking about. So I love this one. It says, healthcare is a human right. So it is your right. It is your right to advocate for yourself, not anybody else but you. So I want to emphasize this again. And then another one that I want to share with you, let me just share this again, talks about your doctor. So your doctor and the patient. So your doctor, you see the team, it's a collaboratory, it's a collaborative, right? It's not just a doctor telling you what to do, it's also you chiming in and sharing your unique situation, letting them know, okay, these are my challenges, these are my social determinants of health, these are, just have those conversations so that they can help you, because if they don't know, they don't know what to do, if they have no idea what those challenges are. And then the last picture that I want to share with you is just community engagement. So this is community engagement. You need the community to build together, right? It's no man is an island. We all help each other. We need to get feedback whenever there's an opportunity for us to do research. I know that we've been hurt in the past, especially in the Black community. So we try to stay away from research. We're always questioning how authentic it is. But that's why we gather the information, right? We ask the questions and we go behind the science, trustworthy people that you're sure about what you're learning and what you're getting. So again, GPS, I want us to start off with gather the information. That is your G, gather the information. Now, part of the gather the information, there's 7 questions that I want you to ask when you see your healthcare provider, right? So first question is, if you're ever going to the doctor and you're not feeling well, you want to ask, what is causing my problems? What is causing my symptoms? Ask the question. Don't let them just give you a diagnosis that, oh, this is arthritis. Okay, what caused it? Why is this happening? All right. So the doctors, the healthcare providers, they do have the knowledge because they're trained, but ask the questions, because I feel like when you know better, you do better. So if you don't, for me, I'm a root cause doctor. I don't just tell you what the issue is. I want to tell you why it's happening, because that is where the power is in knowing what the issues are. So 7 questions I want you to ask. The first thing is, what's causing my symptoms? Why is this happening to me? And then what treatment options do I have? So if a doctor says this is a prescription, okay, yeah, thank you for this prescription. But what are my treatment options? What else can I do? What else can help me other than this prescription? What are number 3 will be, what are the benefits of taking this medication? What are the side effects? Always ask about side effects. Although all medications have side effects, but you want to be aware of what to expect and what not to expect. Number 4, you always want to talk about lifestyle medicine. I am big on lifestyle medicine. I promote that because that solves all the social determinants of health that we have, whether it's employment, whether it's food option, whether it's just all the things that brings a divide in the healthcare system. Lifestyle medicine is just going back to health and behavior. So basic, the air that we breathe, the natural light, sunlight, walking, going for a walk, eating plant-based foods, eating predominantly those plant-based foods, stress management, the breathing. So ask your doctors, do you practice lifestyle medicine? What other medicine do you practice? Is it just medication medicine? I make it a point of duty whenever I talk to my patients, I tell them, this is the kind of medicine that I practice. I go to the root cause of a problem. Let us nip it at the root cause. It's like if the roof is leaking and you're just mopping the ground without repairing the roof. So have those conversations with your healthcare provider. And now the question you want to ask is, what can I do for myself to make me feel better? All right, so ask the questions. They might tell you, well, take the medication. They might tell you, well, cut back on your salt so that you can regulate your blood pressure. But ask those questions and never feel pressured or rushed. Now, unfortunately, in the traditional system that we're in, because it's only 15, 20 minutes, you want to write it down so that you maximize your time, because it's very quick in the traditional setting where patients are only seen for 20 minutes. So you want to be really focused, especially if you're seeing your doctor for the first time. Other questions that you want to ask is, what kind of support is available for me? So in my practice, we have social workers, and bless all our social workers. You guys are tons of help. It's a multidisciplinary approach. We can't do this without you. So ask about support, right? What do you have? A social worker? Do you have a pharmacist? Do you have which other programs do you have? A disciplinary approach? Do you have a nutritionist? Do you have a dietitian? So what other supports other than the healthcare provider that you're seeing? What other supports is needed? And then the last two is, how is each option covered? What is my payment like? Because that's also a big part of, especially with the maternal child health that we see, the Black maternal child health, we just feel this. I unfortunately, there was a sad story where she didn't have insurance and she didn't go to the doctor because she was having headaches. She wasn't sure how much it was going to be charged, and leg swelling, and ended up having hypertension during pregnancy, which we call preeclampsia. And I don't even want to tell you what happened with the rest of the story, but just let us know from the beginning, what are our treatment options, what is covered and what is not covered. And you also, of course, want to inquire about insurance. If you don't have insurance, there are a lot of free clinics that are available, subsidized clinics. There are lots of doctors that do free run clinics, student run clinics. So there are opportunities, but this all comes with the G, which is gather your questions. Please do not sit in isolation. Again, the whole idea is World Health Day, health for all. So let's ask those questions, because if you don't ask, you would not know. So that is the G part. Now let's go to the P part, right? The P part is position yourself as an expert. So educate yourself. So you've asked all the questions, you've got all of the questions, but you want to educate yourself. I guess part of asking the right questions so that you get educated. One of my patients, she shared something with me last week, and I was like, wow, that is so amazing. I was like, I wish every patient was like you. So she said that when her late mom was ill in the hospital, and she's a very, very forward, and I like her being forward because it's her health. She's self-advocating. So she asked about a particular diagnosis that her mom had, and she asked about what it was. And the doctor said, you would not understand. That's what she said the doctor told her. And she was like, wow, she's educated. So she went to the library. She said she spent 2 days reading up on the condition, trying to remember if she called it multiple sclerosis or multiple myeloma, but it was something along an autoimmune disease. And she wanted to understand so that she knows how to help her mom. But the doctor told her, there's no point explaining it to you. You would not understand. Well, she spent 2 days in the library, came back, And at the next appointment with the doctor, she said everything she knew about it. And she said the doctor was flabbergasted. He was like, whoa, So I was like, that is amazing. So that's what we all want to be like. Not going to Dr. Google though and getting all confused, because Dr. Google can get you put in a symptom and it'll give you like 300 things that'll get you also confused. No, educate yourself with the right resource. And I know that we're inundated with all sorts of information on the internet. Yes, I agree. So you want to go to trusted websites. WebMD is one of those. You want to go to places that well-trusted information, so you don't get confused and you don't get information overload. So P, position yourself as an expert. When you're knowledgeable about your medical education or medical conditions, it begins to alert you about your health and your health care. You know your body, you know your loved one's body, you know how they act when they're having, different changes. You can pick up the cues. So you definitely want to position yourself as an expert for your own body. Now, S. Again, we're saying GPS, right? The S is speak up, speak up. So you gather the information, right? You position yourself as an expert. And S is speak up, speak up. If something doesn't feel right, say something, say something, say something. Going back to when I had my youngest child, I just felt very, very funny. I had been checked and I was told that I wasn't dilated. And the next moment I felt like something was very weird. And I told my husband has said, no, the doctors know what they're doing. They said they will come back in an hour. And, initially I kept quiet. I didn't want to be fussy or anything. And I said, no, go call the doctor. They need to come and check. And so the nurse came instead of the doctor. And when they saw that I was very uncomfortable, then they ran and called the doctor. And the doctor came, and lo and behold, my son was already out and he had his placenta around the neck. It was cord, it was around his neck. And it took a while before he could breathe. So there was all of that. So imagine if I had just kept quiet because I felt, oh, well, they know better than me. There's a certain amount of hours it takes for a person to go from, dilating to fully dilation. I knew that I was a doctor, but I knew something was weird. So I spoke out. I mean, I'm so grateful to God that I did that. I've seen so many other situations where people just keep quiet and you just feel the doctor is God. Doctors are not God. We are, yes, trained to help people, and that is what we want to do. That's why we went to medical school, but we're still not God. So you always want to trust yourself and speak up. Let us know when things feel off, when things are not, going the right way. So speak up for your own health, for your own family, for your loved ones. So if it doesn't smell right, if it doesn't sound right, if it doesn't look right, say something. Speak up, speak to your healthcare provider, speak to your nurses, mid-level, whoever it is. If you have just that gut feeling, please, I encourage you to speak up. But the important thing is not just for yourself, but speak up for people around you, because that's how we can change the culture. That is how we can change the system that we're in. And we're hoping and really trusting that this Black maternal health that we're having, mortality that we're having will no longer be something in our narrative, that any Black and brown could go to deliver and come home with a baby. And the same thing with health literacy, that we can all, be adequately trained about our health. And again, chronic diseases, which we see rampant in communities, that also will change. So that's the whole idea. So GPS is definitely gather the information. P, position yourself as an expert of your body, of your situation. And S, speak up, say something. Say it for the community that you live in, say it for yourself. And, of course, in a respectful way, when you're talking to your healthcare provider or your physician, just let them know, and make sure that another example is, and I'm going to commonly asked questions. If a doctor, if you're told, oh, your labs are normal. Okay, what is normal exactly? If you're monitoring your labs and you want to know what the trend is, ask for the numbers, know the difference, see how, is it high, low, is it high normal, or is it high, low normal? That is very important. I remember taking my son, and we were checking his levels, and I asked, they didn't know I was a doctor, and I was asking for the levels. It was like, do you want me to read everything out? I'm like, yes, I would like to know how improved it is. If I'm monitoring cholesterol or I'm monitoring a lab, I want to know exactly what the numbers are. And there's nothing wrong with that. You have access to your medical record. So all I've talked about today is just a way to share how you can self-advocate for yourself, find out about insurance. And there's so much conversation about insurance that will be a topic for another day. But I want you to just empower yourselves and all these different things that you need to equip yourself with when you're going to your healthcare provider. Make sure that you keep up to date with your screenings. If you have questions, I love when my patients come with their notes to ask questions, and they tell me, oh, the my chart tells me that I need the DTaP, I need the TTAP rather, or I need my pneumonia shot. And we look at it together. I love when they do that. So always just look and see, what are you due on? What can we do to make, get you to be up to date with your screening? So these are questions that you always want to ask. Another commonly asked question that I've had patients inquire is that, well, what if I don't get any information about my lab? Does no news means good news? That comes up quite a bit. Well, there's several school of thoughts to that. You don't want, we're humans, there's errors, where nobody is perfect. So just because you haven't heard anything doesn't necessarily mean that it's absolutely normal. So what I do encourage is, if you have access to my chart, even if you're not into the system and you don't know how to log in, please learn how to. Or if you have a grandparent or a grandchild or a daughter or a son that can help you, let them teach you how to, because you have access to your records and you actually see what your results are. So don't just make the assumption that because I haven't heard anything, everything is fine. We've heard several stories about how unfortunately something got lost in the system and nothing, and it was, a complication that arose because they thought the labs were absolutely normal. So if you don't have your results, please have access to my chart. Most places now have abilities to get your results, or maybe ask for a copy to be mailed. Some clinics still mail results, some are just in the my chart. So those are the two commonly asked questions. Again, the goal is health for all, so that we can all be healthy, and not have all the chronic diseases, have all the black maternal mortality. We don't want all of this going on in our communities. So I want to thank you for just listening in and doing your part, right, to change the narrative within our community. We are advocating for health for all. We want us all to speak up about ourselves. Take the power into your hands. Speak for your loved ones. Don't just make the assumption that the doctors or the healthcare providers, they know everything. Even if you're going to a chiropractor, it's just the same thing if you go to the bank, right? And your money, if your money doesn't check out, I know you're not going to let them just, your money should be like $10 less. That matters. So the same thing, if your doctors say something, then just something that is off, call them to it. That's the only way that we can change the narrative. And let's do it in a respectful way, but of course in a way that we're advocating for yourself. So I'm Dr. Babs, your host for the Holistic Perspective show on the WCEG. Thank you so much for joining me this evening. I hope that this has been impactful for you. I hope that you find value, and I really hope that this has challenged you to do things different if you're not already doing that, because not many people like to challenge their doctors or ask questions. So if you're not already doing that, please, I encourage you to do it for you and your family, your household. Be aware of where your health status is, and whatever changes little by little that you can make will definitely get you to that whole state, get you to that vibrant state, and definitely make you healthy. So until next time, we're actually going to be This will be the last for the season, but I look forward to having you return again for another season after the summer. So I do wish you all a wonderful summer. I like to always end with this nugget, which actually shared already, right? That healthcare is a right. So healthcare is a right, but just because healthcare is a right, I want you to understand that if you do have health insurance, that does not mean that you're healthy. It means that you're going to have to look for a provider that works, that aligns with you, that, you know, not just any healthcare provider. You have to ask them about who they are and if they align with you. So healthcare is a right, and health insurance does not necessarily mean that you have the best health. You know, you have to go looking for that physician or that healthcare provider that aligns with your own visions and goals. So don't let anyone take that from you. Yeah, not even yourself. So sometimes we can be our own worst enemy, but don't even let yourself take that from you. So again, thank you so much. I look forward to another season in the coming fall. And till then, I hope that you have a wonderful summer. So take care and God bless.